Hello and welcome to medicinal chemistry classes. In previous lecture we will discuss about antihypertensive agent. In that we will discuss about angiotensin converting enzyme inhibitor and drug act as an angiotensin converting enzyme inhibitor. Okay. So today we will discuss about central sympatholytic drugs. The next drug which act as an antihypertensive agent is central sympatholytic drugs. Okay. The sympatholytic sympatholytic drugs is a medication that inhibits nerve impulse. In the sympathetic nervous system. Okay, the central sympatholytic drug. The sympatholytic drug is a medication that inhibits nerve impulse in the sympathetic nervous system. Okay. The central sympatholytic drug may block the effect of alpha adrenergic receptor or the effect of beta adrenergic receptor. The sympatholytic drug, it blocks the effect of alpha adrenergic receptor or the effect of beta adrenergic receptor. Okay. The adrenergic agent inhibit the signal of epinephrine and norepinephrine. The adrenergic agents are primarily post-synaptic adrenergic receptor antagonist. The sympatholytic drug inhibit or inhibiting the pathway of adrenergic receptor. This receptor located presynaptically. Therefore, to achieve the required action, agonism at this receptor require to inhibit presynaptic release of adrenaline and noradrenaline. For the prevention of post-synaptic adrenergic receptor activation. The adrenergic agent inhibit the pathway of adrenergic receptor and it is located in presynaptically. Therefore, to achieve the required action, agonism at the receptor required to inhibit the presynaptic release of adrenaline and noradrenaline for the prevention of postsynaptic adrenergic receptor activity or activation. The the sympathetic adrenergic system act at three different levels. Okay. Sympathetic adrenergic system. It acts three different levels. First, it acts on ganglionic blockers and block impulse transmission at the sympathetic ganglia. Okay. When the sympathetic adrenergic system it's act on ganglionic blockers, it blocks the impulse transmission at sympathetic ganglion. Okay. When this sympathetic adrenergic system is act centrally acting sympatholytic drug it blocks sympathetic activity within brain. Okay, this is the second pathway. Next, the sympathetic adrenergic system is act on peripheral sympatholytic drugs. It blocks influence of norepinephrine on heart or blood vessels. This is the three different levels of sympathetic adrenergic system. First, it acts on ganglionic blocker. It blocks the impulse transmission on at sympathetic ganglia. Then second pathway, it acts on centrally acting sympatholytic drugs. It blocks the sympathetic activity within the brain. Then when the sympathetic adrenergic system is act as peripheral sympatholytic drug, it blocks the influence of norepinephrine on heart or blood vessels. Okay. The nervous system play major role in regulation of arterial pressure. And increase in the heart rate. Okay. Next drug, which is act as an antihypertensive agent, is your beta blocker. Okay, beta blockers. It acts by blocking the beta blocker acts by blocking the effect of hormone epinephrine also known as adrenaline. Or they are also known as beta adrenergic blocking agent. Beta blocking agents. The beta blocker acts by blocking the effect of hormone epinephrine. It is also known as adrenaline. Okay? Or the beta blocker is also known as beta adrenergic blocking agents. The selection of drug depend upon the health and condition being treated as some beta blocker. Beta blocker act on heart mainly. And other effect of beta blocker is it act on heart as well as on blood vessel. The heart has both beta 1 and beta 2 adrenoceptor although the predominant receptor type in number and function is beta 1 a selective in the drug for beta 1 offers more beneficial effects. The acute treatment with beta blocker is not very effective in comparison to chronic treatment. Because of reduced renin release and effect of beta blocker on central and peripheral nervous system. Okay, so this is your beta blocker. First drug, which is act as an antihypertensive agent, is your angiotensin converting enzyme inhibitor. Next is your central sympatholytic agents or central sympatholytic drugs. Next is your beta blockers. Okay, thank you.